Benign prostate hyperplasia occurs as a result of age, which is a common phenomenon in men. When a man ages, the prostate passes two stages of development. The first stage occurs in the early teens, when the prostate doubles in size. And at the age of 25, the prostate begins to grow again. And this growth sometimes leads several years later to benign prostate enlargement. Although the prostate continues to grow during every year of a man's life, this growth leads to problems only at an older age, rarely causes an enlarged prostate to develop symptoms before the age of 40, but more than half of men in 60 years of age, and nearly 90 of men in 70 and 80 years of age, experience symptoms of benign prostate hyperplasia to different degrees. When the prostate enlarges, the layer of tissue it envelops shifts without expanding, leading to prostate compression on the urethra, irritating the wall of the urinary bladder, thus causing pressure even when it contains a small amount of urine, a phenomenon that causes urination in close periods of time, and over time weakens the urinary bladder and loses the ability to empty urine completely. Narrow analysis and partial bladder discharge are the causes of a large part of the problems related to benign prostate inflation. Prostate size does not always determine the severity of blockages in urethra or inflated prostate symptoms in some men. The size of the gland can be very large, but the degree of blockage in the urethra is small and the symptoms are few. And at another part of men, the size of the gland is lower, but the degree of blockage is greater, and the problems it causes are more, but the degree of blockage is great. Some men suddenly discover blockages, losing the ability to urinate completely. This condition is called acute urine retention, which can arise as a result of over-the-counter medication to treat leaching or allergies. This drug contains a substance that has a stimulating effect on the friendly nervous system. One of the side effects of this substance is that it may prevent relaxation of the urological bladder opening that allows urine to go out. Many symptoms of benign prostate hyperplasia are caused by blocked urethra and progressively damaged bladder. Common among them are urination problems, such as intermittent urine flow, weak, feeling an urgent urge to urinate and leak urine, urinate in close periods of time and at night hours. Of every 10 cases where these symptoms appear, 8 are due to enlarged prostate, but these symptoms can indicate a more serious illness and require rapid treatment, including prostate cancer. Over time, acute benign prostate hyperplasia may lead to difficult problems, such as infections in the urethra, bladder, or kidney damage. They form stones in the urinary bladder. Do not control urination. Urinary incontinence. If the damage to the bladder is durable and irreparable, the treatment of prostate hyperplasia will not be helpful in this case. When bladder enlargement is diagnosed at an early stage, the likelihood of such complications is lower. The factor causing inflation in the prostate is still unknown, and there's no definitive information about risk factors. And it's been known for hundreds of years that prostate hyperplasia usually appears in older adults, and does not appear in men who had their testicles removed before adolescence. Because of these facts, some researchers believe that factors related to older age and testicles may accelerate the emergence of benign prostate hyperplasia. There are several theories about hormones' relationship to prostate enlargement, including the role of testosterone with enlarged prostate. The man produces testosterone, an important male hormone, and also produces a small amount of estrogen, a female hormone, and when the man ages, the level of effective testosterone in the blood decreases, as a result of which the level of estrogen rises. Dihydrotestosterone, another theory focusing on dihydrotestosterone, is a testosterone-derived substance in the prostate, which is thought to help reduce its inflation. The role of growth hormones. Some researchers believe that benign prostate hyperplasia occurs as a result of instructions received by cells early in life. According to this theory, benign prostate hyperplasia occurs because cells in a particular area of the prostate gland implement these instructions and reawaken in late life. Complications of benign prostate hyperplasia: inability to urinate, urinary tract inflammation, bladder pebbles, bladder damage, kidney problems. Initially, the symptoms of benign inflation in the prostate can be observed by the infected person himself, or during a routine examination, it can be observed that the prostate is enlarged. When there is doubt that there is an enlargement of the prostate, it is desirable to go to the urologist, who is a specialist in urinary tract and reproductive system problems in the man. There are several tests that help the doctor diagnose the problem and determine if there is a need for surgery. These tests vary from patient to patient. X-ray digital rectal examination. This is the first examination conducted by the competent physician. Usually in this examination, the doctor inserts his finger into the anus and tries to examine a part of the prostate near the rectum. Prostate-specific antigen PSA. In order to exclude the presence of cancer as a cause of symptoms in the urinary tract, the doctor may recommend this examination, a protein produced by prostate cells, often at a high level in men with prostate cancer. The U.S. Food and Drug Administration (FDA) has approved the implementation of the scan, in parallel to the rectal finger scan, to help detect prostate cancer in men aged 50 and over, and to follow up on treatment in men who have developed prostate cancer. However, it is not entirely clear how protein levels should be interpreted and analyzed. To what extent can this examination distinguish between malignant tumor and benign tumor in the prostate? What are the best ways to work if high levels of antigen are detected? Treatment of benign prostate hyperplasia. Men with symptomatic prostate hyperplasia typically need treatment for a certain period of time, but some researchers question the need to treat early benign prostate hyperplasia in cases where prostate inflation is slight. Instead of starting with immediate treatment, the researchers suggest the following. Regularly check the doctor and stay under regular surveillance that allows problems to be detected at an early stage. Begin treatment when the condition worsens and carries a risk to the patient's health, or causes him a high degree of discomfort. Treatment of urinary tract infections if they arise. It is likely that the doctor usually decides to treat these infections by antibiotics before beginning to treat benign prostate hyperplasia itself. Prevention of benign prostate hyperplasia. In fact, there are no ways to prevent benign prostate hyperplasia, but a healthy lifestyle helps to maintain prostate health, including maintain healthy weight, exercise regularly,